Welcome to eHealth Update, brought to you by Du Bois Regional Medical Center, coming from the studios of the Digital Media Technology Program at Jeff Tech in Reynoldsville, Pennsylvania. I'm John Brennan, Director of Corporate Communications at Du Bois Regional Medical Center, and today on our show we have Peggy Fillinger, an athletic trainer with DRMC Sports Medicine, and Christine Foltz, also an athletic trainer at Du Bois Regional Medical Center. And today we're going to talk about a new program. It's sort of incorporating an old program that you folks have been part of with some new staff members, Integrated Sports Medicine. So let's talk a little bit about what Integrated Sports Medicine is and how it has changed.
I've been in the field for close to 30 years, and it has come full circle, as in when athletes get injured or physically active people get injured, we bring them to one site and they get almost like everything they need at one stop. They get, radiology, orthopedic, eval, chiropractor. We just hired a new guy on board, and he can do things to get you back to your sport as quickly as safely as possible.
Okay, great. And then your role here, you're both athletic trainers. And so that incorporates, you talked about physical therapy, athletic trainers in the office and in the field. We're going to talk to our brand new sports chiropractor here in a little bit later in the show. But let's talk about the team. Let's go here and see who we have. Obviously, a few years ago, Dr. Martin Gillespie came to Du Bois Regional Medical Center, and he is a fellowship-trained sports medicine physician.
That's correct.
So, in the past, orthopedic surgeons sort of, they got their general orthopedic fellowship, and they took care of athletes. But this is a little bit different. He actually went through a 2-year fellowship.
Correct.
To be specialized in sports medicine. And along with that, now he hired you,
right,
and you were with him, and Greg Carpenter was with him at his old location, and you came with him. So how's the transition been? Have you been well received in the community?
I actually really enjoy the new surroundings. I love Du Bois. I think the people and the athletes are very receptive to what we can bring to the area. Dr. Gillespie was kind enough to bring his staff with us to Du Bois. When we got here, we realized that it was a really big need. A lot of the athletes were falling through the cracks, not being seen in a timely fashion, not being diagnosed in a timely fashion. And with that, all athletes know that a high percentage of them, their dream is to go to a Division I institution or to receive a scholarship. So when you're looking at time as being the essence of it, sports medicine really kind of evolved into the point where we can get them in quicker, treated quicker, and back to their sport as quickly as safely as possible.
Sure, we're talking about a football season that's 10, 12 games
Exactly.
long, and if you don't get them in and find out what's wrong and whether or not they can go back in the game, and that's sort of our motto, get back in the game.
Exactly.
If you don't find out in a timely fashion, then they miss 1 or 2 games, and that could mean the difference between them getting a Division I scholarship or not.
Yes, that's very much correct.
So I know that I've talked to a lot of athletes who have come through the program, and they're very grateful. Their parents are very grateful that you're there, because you get them in pretty much Monday after the game.
Correct.
And get them the necessary radiology, whether it's an X-ray or an MRI or whatever it is. DRMC has made spots available for your athletes in the schedule to get them in, get that diagnosis. You want them to be able to be ready for practice on Tuesday if they're able.
Exactly.
So that's I know that probably a lot of the coaches like that too, because sometimes
Yes.
their star athletes aren't sitting on the
Yes.
bench for weeks trying
Yes.
to figure out what's wrong.
Right. When we first came here, we asked what the athletic participants wanted the most out of our practice, and the very first thing that everybody said was availability to the physician. So that's the one thing that we noticed, and that's the first thing that we fixed when we got here. I know as of fact, unless Dr. Gillespie's in the OR, we'll see a patient same day.
Right.
A young man got injured on Tuesday afternoon at 3 o'clock, and he was in our office by 4 o'clock, MRI'd, everything's good. So, DRMC has to be very much applauded for what they've done and allowed the young athletes of this area to stay here and not have to be shipped out to Pittsburgh or State College.
Okay, well that's great. Because I have the two of you in the studio today, we're going to go ahead and jump right ahead to what is an athletic trainer. because I think you both are key players, and there's a difference. We have athletic trainers in the practice, and then we also have athletic trainers at the schools. So, and we'll get to that in a second, but as you're sitting here with me, let's talk a little bit about what an athletic trainer is and what is your role in that orthopedic practice.
An athletic trainer is a medical professional that has gone through a 4-year undergraduate degree and has gotten their Bachelor of Science, and they've also passed a board exam. Athletic trainers prevent, evaluate, and treat sports injuries. We specialize in those kind of injuries, and we specialize in rehabilitation, taping, bracing, exercises, all kinds of things. And then after you are board certified, you actually become licensed in the state, and then that's when you can practice. You can practice in a clinical setting, as Peggy and I do, or more usually you practice in an outreach setting. So at schools, at universities, they're even employing athletic trainers in all kinds of factories, and I know a couple of my friends that have graduated are working in the mining industry. There's a need for us everywhere.
So that's a good point. We're not just talking about high school athletes.
Correct.
We're talking about the weekend warriors. We're talking about college athletes, professional athletes in some cases, and now we're talking about things that you don't really think of as sports injuries, but they are injuries that happen in the work setting that tend to become sports injury related, whether it's an ACL or, and you, obviously I'm not a healthcare professional, so you can tell us some of those injuries. What are some of the things that you see on a daily basis that don't come from sports?
Even, your weekend warrior, they come in with an ankle sprain, or, they twist their knee the wrong way, or they have some kind of a back pain. They're all kind of the same injuries. You could be a 3-sport athlete or just a golfer on the weekend and still have the same knee problem.
Okay.
Well, we had a patient just the other day who was 60, and she just finished a 450-mile canoe race.
Wow.
So at that point, just because we do athletes, it doesn't mean it has to be collegiate or scholastic. It's usually a lot of our patient population could be the weekend warrior.
Okay. So a lot of times, before you push the panic button, seeing the athletic trainer, you might find out that it is something that's very correctable.
Correct.
And I know that Dr. Carlson plays a big role in that. We're going to talk to him in a little bit and see where he fits in with that, because I think a lot of times now he's going to be the first line provider to make sure it's not something he can't correct on his own without having to even go to the next step. So that's where the integrated comes in.
Correct.
Right. Our outreach athletic trainers are actually very important to the team. They're able to evaluate and treat that athlete and kind of filter who we need to see and what the importance of and when we need to see them. There's a lot of things that the outreach athletic trainers can treat themselves. An ankle sprain, they're able to treat that. We don't necessarily need to see that unless it's a grade 3 ankle sprain. That's where they actually tear the ligament.
Well, and they do. I know that we have the athletic trainers in the schools right now. We have 3.
Mm-hmm.
One is in Brockway, and that's Jim Streechek.
Right.
We have one in DuBois, which is Jim Holt, and one in Brookville that we work pretty closely with is Stephen Chip Shear.
Right.
And everybody knows him by Chip.
Yeah, he's a good guy.
So we know that they're out there and they're working with the athletes. And I know that's a large percentage of your referrals come from those 3 athletic trainers in the schools as well, because they work directly with the team, with the athletes. They have hours where the student athlete comes in to see them, whether they're doing taping or exercise regimens and things like that.
Mm-hmm.
So, we get to see those folks working in the schools. We get to see you working in the office setting, and so that's a very big role that they play. Now, Christine, I'm going to jump back here real quick to your slide, and people might be thinking when we talk about athletic trainers, we hear about Kim Kardashian hiring a personal trainer.
Ooh.
That's a different thing, right?
Oh, that is completely different than what we do.
Okay, good.
Absolutely different.
You have a Master's of Science degree.
I do.
You're a licensed athletic trainer, which
Yep.
means you're licensed by the Department of Health
Mm-hmm.
to provide these services. And now you have some other titles: corrective exercise specialist, performance enhancement specialist, and physician extender. So physician extender just means that you work in a practice setting,
In a clinical setting,
orthopedic
correct.
clinical setting.
Correct.
So that distinguishes you from Jim and Chip.
Yep.
Because they are athletic trainers in the school. They don't work in the office.
Correct.
Tell us a little bit more about some of these other specialties that you have.
Well, I got my Master of Science in Rehabilitation Science. I've always been really passionate about the prevention in the athletic training role. I do corrective exercise. I got certified through the National Board of Sports Medicine. What I do is I watch individuals through functional movements, daily movements, squatting, walking upstairs, jumping. I watch their movements and I identify faulty mechanics. And in these faulty mechanics, I'm also able to identify the underactive muscles and the overactive muscles. And then from there, I'm able to, create a rehabilitation program that can help make those faulty mechanics into a good functional kinetic chain so that they can prevent injuries in the future.
Okay, so that's a prevention program. And it sounds like it sort of goes hand in hand with performance enhancement as well, because
Correct.
Obviously if you have the right mechanics, you're going to do better.
Yep. Once you got the mechanics down, then we can work on making you bigger, faster, and stronger.
Okay. Peggy, we don't have a slide for you here because we sort of threw you in at the last minute, and we appreciate you coming. But you also have some specialized certifications and things that you've gone through.
Yes.
And something that's really big in the news right now, concussions. And obviously if you live in central Pennsylvania, western Pennsylvania, this has been an issue since Sidney
Yes.
Crosby came on the scene. He has spent a large portion of his career fighting concussions. Even before him, those of us that are older remember Merrill Hodge, the running back for the Pittsburgh Steelers. Most people know someone who has had a concussion in their lifetime. Fortunately, not everyone is an athlete and has those issues, but anyone that has had a concussion now in the athletic realm
Right.
is sort of subject to a lot of different things. All the schools now are going through this impact,
Correct.
where they do a baseline test on every athlete.
Correct.
So what is your role in that? I know that you have sort of a unique certification classification.
I've been practicing athletic training for, like I said, close to 30 years, and I have seen the evolution of the research that's come through UPMC, and we all know that they're the father of concussions. I work very closely with Mickey Collins, is one of the main inventors of Impact, and Pennsylvania, and as well as I think 23 other states, have now made it law that if you suffer the signs and symptoms of a concussion, you have to be removed from participation. Here in this area, we're very lucky that most of our local schools have an athletic trainer, and they know the signs and symptoms of concussions. But what I felt I needed to do for this area was a new program came out because of the influx of concussions and the scare tactic of kids who can't play, or the Sidney Crosby incident, that people were being labeled with concussions and not being able to get back to their game or get back to their sport as quick as possible. So Mickey Collins and I sat down and I became certified in a program called Athletic Trainer Impact Trained. If a young man or a young woman suffers what they think is a concussion, and they get a post-test, which is after the baseline, and they compare the two tests, and they seem to be in the ballpark without many discrepancies, that athlete can and should go back to their sport. But because of the influx of it, they can't get to a specialist, a medical doctor. They're sitting 3 and 4 weeks waiting to get into that medical doctor to be cleared. Please understand, the ones that need it, they should stay and follow the course. But there are kids who are labeled because of the scare tactics that could go back to play. So I have now been certified to examine the young athlete, check their scores, do some cardio, see if anything comes up, and let that person go back to their game. They do not have to go to a medical professional. So I'm kind of the inner mix right there. So
and we actually have a whole team of professionals at DRMC that has
Correct.
been working on this because of the federally mandated and state mandated programs that are going on. We have a neuropsychologist at DRMC, Dr. Bridgman,
yes.
who works on this, and in conjunction with our physical therapy folks, Pat Dennison and Marty Maloney, have been they've done algorithms that we have provided to the pediatricians. and to the ERs throughout the region so that they can see what the progression is supposed to be coming through that program. So we feel at DRMC we are leading the way as far as concussion. I know that we have done programs because right now it's mandated in the scholastic athletes.
Correct.
But we also have a lot of youth programs out there, whether it's youth soccer, youth football, youth baseball, and we've actually provided the impact baseline testing to those younger athletes. So the youth football programs and the youth soccer programs have all been in, and we've provided the impact baseline testing. So now if a soccer player that's playing in Du Bois Youth Soccer League gets hit, we're going to be able to tell whether there's real serious implications or if it's something where the student athlete can go back. And these are not student athletes. They're not the Du Bois High School team. It's the Du Bois Soccer Association. So that's been a big thing locally to try to get those kids in, get this baseline testing, because that's really the only way. Now, what are they measuring, Peggy?
Well, what it is they go with recognition, reaction time. They look at the cognitive skills. They ask them to read and remember words. In a concussed athlete, those things that are very simple to us normally, in a concussed athlete, they will be much harder to achieve. So that's why they give the test prior where there is no injury, and then the post-test to compare the two tests. And usually the symptom score and the memory and the reaction time are the ones that are the most affected. And the last thing you want is a kid with a bad reaction time out on a football field where he can't protect himself.
Right.
So, and one of the biggest things is the second impact. And that's what they say happened to Sidney Crosby, was there's a concussion, he wasn't treated properly, then he went back in and got the second concussion, and that's what really led to his lengthy time off the ice, was the second impact syndrome. And that's basically what we're here to prevent.
And you hear a lot of people say that it's the contact sports, you have to watch out for football and hockey.
Right.
But I'm sure over your course of your career, you've seen athletes in pretty much every sport get concussions.
Correct, I have. Very much.
It's, cyclists.
Falling off the bike.
There's just lots of, maybe not golfers, I don't know, unless you don't duck when
unless you golf
somebody else
without me and get hit in the head with a golf ball. But no,
but so
usually
concussion
just the contact.
is something, and I don't know if you got to see the Frontline special.
No, I didn't.
PBS ran a 2-hour special on concussions, and of course they're sort of out to get the NFL.
Right.
And the questions that came out of that, I got to watch it, and then they did a follow-up show locally, and I got to watch that, and they're making all kinds of good points. It doesn't seem to me like there's a very good answer to how to prevent concussions. I mean,
no, the thing that we try to do in our field, and the coaches sometimes get upset about it, is proper technique. Like I said, I've been in it for 30 years, and I've never noticed people hitting with their helmets as much as I have in the last 10 years, and that's when concussion became a big thing on the radar, is that if you teach proper technique, I think that we could reduce, we'll never eliminate, but we can reduce the amount of concussions we see in collision sports.
Okay. So I'll tell you what, we're going to take a quick break here. We're going to see if Dr. Carlson will join us up here on stage, and we'll get back to talking a little bit about the team and how things function.
Okay.
You are watching Du Bois Regional Medical Center's eHealth Update, coming to you from the Digital Media Technology Studios at Jeff Tech, with the help of Mr. Sam Otero and his students in the Digital Media Technology program. We're going to take a short break, and when we return, Dr. John Carlson, chiropractic sports physician.
My name is Jeff Harrison, and I'm from Du Bois, Pennsylvania, and I have two sons here at Jeff Tech.
Parents know the value of an education that works.
Technical people are important to our society and our economy, and it's one way to work your way up. You have to get a good foundation. And I think technical training is where you get that. Where else are you going to get that? And this place is like a gem. It's like a diamond. It's like, wow, we have this in Reynoldsville, Pennsylvania.
Take a video tour online at jefftech.us.
Looking for a great career in high technology? Whether you want to start your own business or go on to college, the Digital Media Technology program at Jeff Tech offers the most advanced training and studio available in our region. Learn audio and video production, live web streaming, 3D animation, and special effects. Graphic and web design using pro software, Photoshop, Fireworks, Dreamweaver, and After Effects, InDesign, Premiere, Wirecast, and much more. Full-time and part-time enrollment options are available for high school students and even adults in our area.
these situations that I've seen here at Jeff Tech are purely hitting the college level. I mean, you know, there are people who are waiting 4 years out of high school to go into 4 years of college to do the same things that the students here are doing right now. And so, needless to say, you want the jump start, this is the place to be.
Explore the Digital Media Technology program in the IT Academy at Jeff Tech. A whole new world of opportunity awaits you. Visit us online, dmtstudio.net.
Welcome back to Du Bois Regional Medical Center's eHealth Update, coming to you from the studios of the Digital Media Technology program at Jeff Tech in Reynoldsville. We're back in the studio, and we have some new guests joining us. Dr. John Carlson, chiropractor at Du Bois Regional Medical Center, and some special designations. And staying with us on stage is Peggy Fillinger, athletic trainer in the DRMC Sports Medicine practice. Let's just get right into it, Dr. Carlson. What is a sports chiropractor, and what do they do?
Well, a sports chiropractor is a chiropractor, so you see the original back pain patients and whatnot. But a sports chiropractor is certified through the American Chiropractic Board of Sports Physicians. It's one of the few recognized, sports programs for chiropractors to get into. It's similar to doing a residency. So after you become a doctor of chiropractic, you move on and do more education and more schooling and take another national board to become an actual sports certified chiropractor.
So similar, like we talked about Dr. Gillespie doing his fellowship to specialize him. That's sort of
similar, not quite to that extent. We're not doing surgery, but
right.
It's still the on-field training, the special assessment for injuries for sports athletes. We get into some of the concussion assessments, and it also allows you to do different things in your practice and out in the field.
So you were an athlete, and I consider Emporium local because Du Bois Regional Medical Center's range is fairly large. So you were in Emporium, Cameron County High School.
I was. I grew up in Cameron County, went to Cameron County High School, played sports there, and then eventually moved on to go to Lycoming College, where I was an athlete there also.
So that sports-related field interested you from the very beginning, probably.
It did. I was always interested in becoming some sort of physician to help with athletes. Like Ms. Foltz said earlier, I'm big on the injury prevention and performance. I want to see the kids not get hurt as opposed to fixing them after they do. They're both very important parts of sports medicine. But then also I realized growing up here and being an athlete in rural Pennsylvania, how it was sort of underserved in the need for, a legit sports medicine program in the area so that we didn't have to travel so far. I remember when I was growing up and, suffering some injuries, I had to go the whole way to Williamsport or Pittsburgh to be treated.
Sure.
So it's nice to see that, we have a program developing here that can help the athletes.
Okay, so you have some special designations. So it's sort of a very unique certification for this area. We don't have a lot of folks that have your background and your skills in our region.
Right. Well, the CCSP certification, if you get on the website and look, out of the 60,000 chiropractors in the United States, there's about 4,000 that have taken the board and passed it. And then what you actually do with your certification can also, sort of change. So some people just go back home and they have their designation and work in their practice and work by themselves, and some of us go out and we get involved with athletic trainers and orthopedic surgeons, working with teams, and that's the path that I chose.
Okay, so there is a difference, and the fact that you're part of the sports medicine team really shows people that this is a progression. We talked about sports medicine, about what the orthopedic field is involved with, and now we're adding you. So what do you bring to that team then from the chiropractic sports?
My role in, the role in these new big integrated sports medicine programs is to help bridge that gap between the athletic trainers on the field and in the clinic, and then Dr. Gillespie, who's the specialized surgeon over here. So we have sort of that middle area where I can help expedite the process, so to speak. So ordering the radiology studies, helping with some of the diagnostic testing, and determine whether or not they actually need to see the surgeon, whose time is very valuable. And a lot of times the surgeons will get bogged down in those older programs that don't have sort of the middleman to help out. And then, with everybody that's non-surgical, so to speak, they can help with the bracing and taping, with our trainers. And then also I have the different methods for treating also.
Okay, because we heard Christine talk about the reassessment and the mechanics and things. You also look at those things. You have certain ways to help them correct their mechanics and prevent injuries and prevent, even after they're injured, you look at them and because I've witnessed some of the things that you've done. You can sort of look at an athlete, feel the joint, and decide, it's a mechanics issue, it's a muscle, it's a bone, it's a this or that. To me, it's interesting because I hear you talking about tools, and your tools are different than what the tools would be in the orthopedic practice.
Well, and it's sort of a blend of orthopedic and then also what the athletic trainers are taught with the physical medicine end, but then we add that chiropractic component, the joint specialist, the mobilization, the body mechanics, how actually joints move, and we saw Christine earlier talking about kinetic chains. So it's about how the individual functions in these different patterns that we're used to. So I can use some of the techniques that I use to expand on certain things, but then also it's important we get these injuries. So say an ACL injury in a girl basketball player. Most of those are non-contact injuries. So about 70% of the time when a female athlete injures her ACL, it was just she landed, her knee twisted, and she tore her ACL. Even after Dr. Gillespie fixes that, and Peggy can tell you, he fixes it, he does a great job, it's awesome, but if we don't get to the underlying mechanics of why she actually injured herself or what muscle groups or joints weren't working properly, then she's still predisposed to re-injuring that knee that's already been fixed.
Wow, that's amazing that we are at that level locally to be able to provide those kinds of services. So you have specialized training. And like I said, you talk about tools. All of these are tools, right?
Correct. It's not one thing fixes everyone. So, earlier we were talking about the integrated sports medicine program. Mm-hmm. The whole idea of the integrated sports medicine program is everyone working as a team. So you can figure it as any type of sports team. Everybody has their own role, but everybody has different plays in their playbook that they can utilize to help the athlete get back as safely and as quickly as possible. So, I may need to do one thing for the athlete, and Peggy and Christine can do something else. Dr. Gillespie may need to do an injection or a surgery, but it's that collaborative effort of all these little tools, just like tools in a mechanic's toolbox. It depends on the situation, and if you don't have all those tools, a lot of times you don't get to the underlying problem.
Okay. Do you want to talk about some of these tools, or do we want to?
It's one of those, we could get bogged down talking with that, and, if we stick to sort of the generalization of what the program's doing, we can go back if we have some time.
Okay, we can talk about those again. So here's the question. You're talking about athletes who have been injured. Obviously, they're going to come in and see you folks. Are there other reasons? Why would an athlete or even a weekend athlete want to come in and use sports chiropractic?
Well, in sports chiropractic, like I said, it's sort of that blend between, getting from the athletic trainer to the surgeon. So a lot of times the lead time to get in to see the orthopedic surgeon is, several weeks. A lot of the, athletes we can get in quicker. But even in my practice that I used to have in Emporium, the athletes could come in, start getting treated on day one. If they, get rehabbed and can get through that injury without any sort of surgical intervention, that's what we want to do quickly and as soon as possible. And then also, on a surgical end, like we have a slide coming up that'll show you, my role is to help the orthopedic surgeon have the best possible outcome. So if the athlete's getting the biomechanical corrections and doing the rehabilitation prior to surgery, if they have to have that surgical intervention, their outcome is going to be much better. So the better you are before you go into surgery, the better you're going to be when you come out.
Okay, so you're really helping the surgeon, and then the surgeon in turn is referring back to you afterwards to increase the effectiveness of the surgery with the athlete. So I think your offices are right across the hall from each other. You're sharing. I mean, these folks don't work for you, but they work with you. So it's pretty amazing to see all those pieces in place. And again, we're starting out. We're just starting this program. Hopefully, in a year we can come back and do another show and maybe bring some athletes back as well. Is there more on this slide that we want to talk about before we move?
It's one of those, if you want to talk about, the chiropractic part, that sets us apart from, say, not just doing the physical medicine or physical therapy, and the manipulation part is sometimes a lost component of treatment of injuries. Mm-hmm. So take an inversion ankle sprain. Everybody's rolled their ankle. Lots of athletes get inversion ankle sprains. And some of the mechanics that occur with those type of injuries can result in predisposing the athlete to injuring that ankle again. So, we can rehab it all you want, but a lot of times on an inversion ankle sprain, the small bones of the ankle and foot get moved. And, they don't technically dislocate, they just shift a little bit, which is called a subluxation. But if you don't correct that, then that athlete's mechanics are now, not necessarily injured, but the mechanics of the foot just don't work properly. But that will predispose them to further injury of that ankle. So if the little bones of the foot aren't moving properly or weren't manipulated or adjusted to get back to where they're supposed to be, the mechanics are still not corrected, and then that inversion ankle sprain will occur again.
Okay, so prevention,
treatment, and then also
mechanics.
Correcting the biomechanics afterwards.
Okay, so that's pretty amazing. And I have you were willing to let me kind of come with you on one of your trips down to State College, and I don't know how much we're allowed to talk about that, but I know that you are you work very closely with the Nittany Lion Wrestling Club.
I get to travel with those, and it's a lot of fun. Those are the Olympic athletes, and Olympic wrestling is different than collegiate wrestling, just in the styles. But these are the guys that have graduated from the university, and now they want to try to make the Olympic teams and travel around. And now that it just got voted back into the Olympics, as that was all the big scare. But now we have the resident athletes that train year round to try to win a gold medal.
So these are athletes who have been to the Olympics or maybe going to the Olympics, and I got to witness you working with some of them. It was very impressive. They feel very strongly about coming in and getting worked on, following their regimental training and things like that. I saw you give them tips on their strength training and how they can improve their mechanics on their strength training to prevent injury. How did you get involved with that?
Well, getting involved with that, part of the CCSP program is you're supposed to work with teams. And, with my wrestling background, I just chose to, knock on the door and ask them if I could work with the team. And, I had some contacts there, which had helped, and me being a wrestler helped me get in with that program. But the biggest benefit that they saw was the injury prevention and performance aspect of my functional assessment. So going in, screening the athlete, watching them do what they do, and I can say, okay, well, here's where you perform really well, here's where you don't perform as well as you should, which could result in an injury. So, your strength coach needs to talk with you, work out a program to address these issues where you don't perform as well. And, the pitch of it is it's sort of like fine-tuning a race car. The difference at the Olympic level and professional levels is, tiny little gains. So, these athletes are so elite in what they do that, any little thing that helps them perform just a little bit better can make the difference between winning a gold medal or a silver medal or not even making the team. So
a tight muscle versus a loose muscle.
Yeah, it's sometimes tenths of a second matter.
Stretching. I heard you talk a lot about stretching and working out the muscle following their regimen.
Correct. And everybody develops compensations based on how they're training, and it's correcting those compensations that matters. And a lot of these guys, they get worked on before events and then after events because they want to be able to perform at that elite level with nothing hindering them in their performance.
So the next slide isn't a wrestling slide, but it's sort of a football analogy that we talk about, and this is something you created. If you could increase your ability to score, whether it's a wrestler, whether it's a basketball player or football player, as we see here, that's every athlete's goal, right? To increase their performance.
Correct, and it's that performance enhancement aspect of it, whether it be the patient going into surgery. We want them to have the best outcome after that. So you got to try to get the person as perfect as you can get them. Nobody's ever 100%. So if you're competing at 80%, you can only achieve so much. But if we can get you to 85 or 90%, you're going to be that much better. And the same thing applies to injuries. So we say, okay, the patient suffered an injury. Now they're at 50%. We have a certain guideline where, Peggy isn't going to release them to go back and play until they reach a certain percentage. That might be 85%. They can go out and play, their injury's healed, but they're still not back to that 100% they were pre-injury. So that's the whole goal, is try to get them to that elite level again, get them back to as close to 100% as they can.
So you're helping them increase their percentage, not based on the surgical outcome, but based on those other factors.
Correct.
Okay. All right. Hopefully, I'm not leading you astray with what we're talking about here. So, we talked about some of your wrestlers. You have other athletes that you work with, and as we grow the program here in Du Bois, we're hopeful that many other folks will be using your services. But we really are talking about a new era in sports medicine because prior to probably Dr. Gillespie getting involved in sports medicine, it was come on in and we'll cut you and fix you up. And now there's so much more to it. I know, and I have to say, and I'm not downplaying the sports medicine physicians that we've had here in the past, but they did not employ athletic trainers. They didn't have those folks in the program with them. They were surgeons, and that's what they did. Now we have a whole team of folks, and so it is really a new era, and the focus is, like you say here, injury prevention and performance enhancement. You do something that brings a whole new level to the game, right? With functional assessment?
Sort of. It's sort of the new era in trying to prevent injuries. Ms. Foltz was telling us a little bit earlier about her, screening athletes and prescribing corrective exercises for that based on what she sees. And, there's just some different, schooling and studying you can do to expand upon that. And, working with her, we can analyze these athletes and, whether it's a little problem or a big problem, we can, figure it out, determine if it's a joint issue or a motor pattern, even, someone doesn't fire the right muscles in the right order, get that corrected, and then they're not as predisposed to those injuries as they were before.
Okay, so we're going to go ahead and switch here. Did you want to say something? Okay. So functional assessment, how do people come in and talk to you about this? I mean, obviously these aren't patients who have had injuries. These are you want the athletes to come in before they have their injuries, correct?
Correct. And a lot of times, we'll even go out and do an outreach program. We'll go to the school and talk with the coach and say, hey, here's the service we can provide for you and your athletes. And I actually have a little computer program where we'll screen all the individuals by themselves. And it says, okay, this athlete's doing really well here and not so much there. And there's 10 different screens that we'll do. So we analyze all the different athletes, and then we can plug all that data into the computer, and it says, as a team, here's where you guys aren't doing as good as you should, or as well as you should. So, you're doing really well here and not as well here, and here's a really important area where you're failing and need to change how you're training to either add something or, take away, you're doing too much in this one area, which is causing you to compensate in some, in a different area.
So this program actually could give our local teams quite a bit of benefit then. How do they get in touch with you? Do they just call your office and say, we'd like you to come out?
Yeah, they can just contact the office, or they can contact Peggy and Christine, and we can set something up to go out with the outreach program and analyze their athletes. We can even watch how they're practicing and what they're doing at practice. And she has 30 years of experience, and I can't even come close to that yet. So she's a very valuable tool, and she'll go out and she might pick up things that I don't know, and that's where we work as a team.
Right.
And even though I'm the sports chiropractor and she's the physician extender and the athletic trainer, we all have our own tools and things that we see and our own knowledge base. And to me, the well-trained athletic trainers are worth their weight in gold, and we can't replace them because they're our eyes and our ears on the field, and they see the injuries, they know the athletes, they're working with the parents, they're working with the coaches, and they're putting the time in. I see the athlete when they come into my office, and they see the athlete every day. They become, almost part of the family there. So, they're very important.
Very well said, Dr. Carlson.
And then I think an important note is too that all of you are athletes.
Mm-hmm.
So it's not like you don't know that side of it as well.
Right.
So I think that's important, that you kind of have the same thought patterns as the patients that are coming into you. And again, we have to note that it's not just those scholastic athletes or the college athletes that you can work with. I'm sure there are lots of runners out there who they're not doing it as profession or looking to go pro in anything, that you could offer this to, and that would improve and basically you're trying to cut down the patient flow through Dr. Gillespie's office by preventing these injuries in people, and that's it might not sound like a good business plan, but it really is good for our athletes to do this.
Well, and it's just having that, the big expansive program all involved, so that we're preventing the injuries, but then when people do suffer injuries, we can treat that, and it's comprehensive and everybody's involved. But then also, we talked about patient access, and our patients being able to have that need to get in to see the doctor so that they can get on the field as quickly as possible. So what happens is, if we just all go see the orthopedic surgeon, then it might be 3, 4, 5, 6 weeks out before that athlete can get in to see someone. Which, if you can't see the surgeon for 5 or 6 weeks, now you're out. Not to mention, if you do have an injury, you've waited that long to be treated. So you're just setting yourself that much farther back to get back in the game.
And not all patients that come to you end up having surgery, right? Very small.
I would say about probably 60% of our patients are surgical.
Okay. So that's good to know that
the surgeon will never lack work.
Right.
That's for sure.
Right. No, and that's not our goal, obviously.
Right.
But it seems to me like we're creating a whole new field that people can come in and have these things done that, like I said, aren't even injured, right?
Correct.
There's the preventive and the maintenance type things that you do that are very important, and that's part of the thing. We don't want people to think that we're here just promoting, once you get injured, come in. I've seen you work with a swimmer. I know that you work with volleyball players. I mean, it's pretty much every field, every sport.
Well, it's not even just sports. So, if you're the guy that likes to go golf on the weekend, or, we even break it down into the mechanics of how, you're running the vacuum cleaner in your house that might predispose you to a certain type of injury, or, we see a lot of shoulders of people that are just, working, doing their everyday job, but because they sit there and do the same job every day in the workforce, they develop some sort of injury or compensation, and we correct that for them, and they can go back and enjoy their day and live without that shoulder injury or their knee injury or the back pain or whatever it might be.
And you mentioned back pain. I think we're gonna, that'll be a whole other show where we talk about your specialist certification for your spine.
Correct.
Because that's part of the title.
Yeah, that's
that
part of the
sort
title.
Of left off of this program, but we can talk about the spine work that you do as well in another program.
Right. Yeah, we can talk about the interventional spine team on the next episode.
So you put this on here as sort of an example, right?
Correct.
So go ahead and take us through this. Let's talk about the lower extremity functional assessment.
Well, if we can look here on the screen, this sort of explains that non-contact ACL injury in a female athlete. So if you can look at the athlete here on the left, you can see how whenever she does the single leg squat, her knee and hip and ankle stay in line and her pelvis is level. And the other girl over here, you can see how she's compensating. And her hips falling on the one side, and then her knee starts to move to the inside, which is called a valgosity. So this female athlete here on the right-hand side, she's predisposed to tearing that ACL because of the mechanism of what the actual ACL does. So that rotation of the knee puts stress on the ACL, and then that's why she would tear that ligament and have that injury. And this girl here on the left, she is less likely to have that injury because her mechanics are correct.
Okay. So that's pretty amazing that you can tell people how to prevent the injury before it happens.
Well,
or at least try to prevent.
It's biomechanics and how the body works, and you apply the physiology and just look at it in a more mechanistic way than we're just having these injuries and we're going to fix them.
Yep.
Okay. So obviously you've been involved, both of you have been involved with sports medicine for quite a bit of time. There has to be some very exciting success stories that we could end our show with today. I know I've been involved a little bit more with you. You're just starting out with us, so I haven't really gotten to hear a lot of stories from you. So let's start with Peggy. I know that we've had some very nice success stories with some local athletes, and we're not going to mention names, but give me an idea. I know that one in particular stands out.
We had an injury come to us on a Monday morning. Priority schedule, was injured on the weekend. He was saw in our emergency department and diagnosed with a complete fracture of his tibia. Everybody knows that that's the big bone in the lower leg, and it's the largest weight-bearing bone in the body, and so it's a very significant, severe injury. We were very lucky that the man who was on at the ED referred him to us. Usually the normal orthopedic process of treating that injury is to take him into surgery and pin it, because it's such a vital bone in our body, and again, adding to the biomechanics, has to be right on or else we end up suffering other problems. But with Dr. Gillespie having the sports medicine fellowship and this young man being an athlete, together with the will of both the physician and the patient, we decided to treat him conservatively. Put him in a cast, made sure that he was immobilized in the proper ultimate healing position, and that's exactly what we did. The patient did everything that he was asked to do. Dr. Gillespie brought him back on a weekly basis, made sure everything was going in the right order, and the kid emotionally had problems because he identified with his sport. He wanted to come back, he wanted to play the next season, and very much depended upon both of our efforts, the athlete's effort and the physician and the team's efforts. It was awesome. The young man did exactly what he was told to do. He worked his core, his abs, his shoulders, his other leg. Didn't lose much of a season as far as his basketball season. He got to go out and play before it was over. If he would have gone to any other orthopedic surgeon and they would have pinned it, that would have been a proper treatment. But due to it being a sports medicine doctor, he chose to treat it differently. And the young man accomplished his goal. He wanted to play basketball, and he did, and he was back to sport 3 months after a complete tibia fracture, which is usually unheard of.
And so he didn't miss the whole season.
Right, he
didn't miss the next sports season,
correct,
which he was also a multi-sport athlete.
Correct. He missed the rest of the sport that he injured his leg in and half of the next season. If that would have been pinned, he would have been done completely for that year. So his whole junior year would have been scrapped in September. But the interesting part about this young athlete is that Dr. Carlson was on board not soon after this all happened, and his later stages he was put in a walking boot, and it changed his biomechanics. So he now started experiencing other parts of his body being altered in his gait. So we took him over to Dr. Carlson, and he even helped him even more. So the whole team came into focus on this one injured athlete, and the young man played awesome. We went to watch him. It was a great outcome and an exact example of the difference between orthopedics and sports medicine.
Right.
So it was
team.
good. And the team.
I mean, that's a great example.
Yeah. So, and I'd like to touch on, a lot of athletes identify with their sport, and if you take them out of their sport, for safety is one thing, but if you can do things to get them back quicker and to avoid the depression and the things like that, it helps all the way around.
And I would think the motivation for him not to miss a full year was a factor too, because
correct,
like you said, he did work out those other muscle groups and stayed in shape. And I would think that's a big factor in recovery, is whether or not you can motivate yourself and you as a health professional
right,
to motivate your patient.
Right. It was a great story, and a story that we hope to be able to tell 100 more times before our time is over. So.
Okay. And I know DRMC has a very robust physical therapy program as well. We have offices in many different locations. We have, of course, at our Medical Arts building in Du Bois. I know that you work hand in hand with them.
Correct.
I know now we're hoping that soon that we'll have some great success stories here from your office in Du Bois, but obviously you've worked with athletes all your career. Give us an idea of some of the things that have happened that worked out.
Fortunately, I haven't had to deal with too many major injuries like tibial fractures. If they come to my office for that, that's just not the right place to be. But my experience being a sports chiropractor and being on the field, working with these different athletes on different stages, you see a lot of injuries that, an inversion ankle sprain or something that might take somebody out of a competition. Say it's a team trials to make a team or even a championship. And just being able to, work on these athletes, say they have an inversion ankle sprain with those different tools that we talked about, being able to do the manipulation and the soft tissue work and then the kinesiology taping and keeping them on the field, it's, a whole lot different than what would happen before. So you can work on the athlete and then keep them in the game, and then they're no longer, sitting on the bench and not competing. So a lot of the wrestlers I work with, we all know that's an individual sport. So we've had some times where, it gets a little hairy and someone squeaks out a win and they're injured and they come off the mat, and, we go and work with them and get them back on so they can continue competing, and, they end up making the team or winning the tournament. And, the same thing applies when I'm working with the volleyball players that, they run around and, they're traveling all over the country, and, on a two-person volleyball team, if one goes down, that's the end of their tournament. So, doing the different methods to keep the shoulder injury in or the knee injury in and let them compete the rest of the day, that's where, my specialty is.
Okay. All right. Anything else you'd like to add before we close?
No,
Did
thanks.
we cover
Thank
everything?
you for having me.
Thank you for having us.
All right. I appreciate you coming in again, Dr. John Carlson, sports chiropractor, and Peggy Fillinger, athletic trainer at DRMC Sports, and again, Christine Foltz, thank you for joining us. You have been watching Du Bois Regional Medical Center's eHealth Update, coming from the studios of the Digital Media Technology Program at Jeff Tech. Until next time, I'm John Brennan. Thank you very much.
Looking for a great career in high technology? Whether you want to start your own business or go into college, the Digital Media Technology Program at Jeff Tech offers the most advanced training and studio available in our region. Learn audio and video production, live web streaming, 3D animation, and special effects. Graphic and web design using pro software, Photoshop, Fireworks, Dreamweaver, and After Effects, InDesign, Premiere, Wirecast, and much more. Full-time and part-time enrollment options are available for high school students and even adults in our area.
These situations that I've seen here at Jeff Tech are purely hitting the college level. I mean, there are people who are waiting 4 years out of high school to go into 4 years of college to do the same things that the students here are doing right now. And so, needless to say, you want the jump start, this is the place to be.
Explore the Digital Media Technology Program in the IT Academy at Jeff Tech. A whole new world of opportunity awaits you. Visit us online, dmtstudio.net.
Going to schools such as Jeff Tech, I think, gives you a good foundation and opportunities that otherwise you wouldn't think of doing.
Parents know the value of an education that works.
I think if you look at salaries and you look at earning potential, management jobs, getting out of Jeff Tech, you already have a jump start. You're in demand. You can start earning money faster. It's like the turtle and the hare. I mean, you're the hare, baby, and you're ready to roll.
Take a video tour online at jefftech.us.